My name is Jennifer Koskela. I'm an Indiana State University student. This is my health education program for my community health nursing course, and it's titled Congestive Heart Failure. The population at risk that I'll speak about today are the obese elderly population, and they're at an increased risk of developing CHF due to their lack of knowledge about the disease and their lack of knowledge regarding methods of prevention, detection, and the treatment of the disease. The learning objectives for this education program are to identify nutritional changes that impact patients with congestive heart failure diagnosis, identify the risks of congestive heart failure, recognize the importance of lifestyle changes, and be able to identify early signs and symptoms of congestive heart failure. Please take a moment to pause this video and take the pretest.
Do you know the symptoms of heart failure? During heart failure, the heart can't pump blood efficiently enough to meet the body's needs because either its pumping ability has weakened or because the lower left chamber has become thick and no longer holds enough blood. Without proper pumping, fluid can build up and cause symptoms that everyone should learn to recognize. Swelling, also known as edema, is most often noticed in the feet, ankles, legs, or abdomen. Sudden weight gain. People with heart failure can also track their weight to help manage any swelling. Shortness of breath is another important symptom to discuss with your doctor, especially if you notice that normal activities are getting harder to do, or that your breathing is often interrupted by persistent coughing or wheezing. You should also speak with a healthcare provider if you lose the ability to sleep and breathe well while lying down. Inadequate blood flow can also cause lightheadedness or fatigue, confusion, depression, or even fainting. Additional symptoms can sometimes include a rapid heart rate, nausea, or lack of appetite. If you notice these important symptoms, be sure to seek medical care. People who have heart failure can track symptoms to help manage it successfully for a longer, healthier life. Know the symptoms so that together we can rise above heart failure.
Methods of prevention for congestive heart failure include smoking cessation, weight loss, decreased sodium intake, and maintaining a blood pressure within a normal range. For smoking cessation, it does a great deal of good for your body. Within 20 minutes, your heart rate and your blood pressure drop. Within 2 to 12 weeks, your circulation improves and your lung function increases. Within 1 to 9 months, coughing and shortness of breath decrease. By 1 year, your risk of coronary heart disease is about half of that of a smoker's. In 5 years, your stroke risk is reduced to that of a non-smoker 5 to 15 years after quitting. And in 15 years, the risk of coronary heart disease is the same as that of a non-smoker. Weight loss is also a big factor. Obese people require greater amounts of blood, making the heart get tired faster. Obesity is also linked to high blood pressure, and obese people are more likely to have higher levels of fat in their bloodstream. Elevated levels of these types of fats can cause heart disease. As you can see here, decreased sodium intake does wonders for your health as well. Keep your sodium intake in check as part of an overall heart-healthy eating pattern that emphasizes a variety of fruits and vegetables, whole grains, low-fat dairy products, skinless poultry and fish, nuts and legumes, non-tropical vegetable oils, limiting saturated fats, trans fats, sodium, red meat, sweets, and sugary drinks. Excess levels of sodium can cause increased water retention, which will lead to puffiness, bloating, and weight gain. 9 out of 10 Americans consume too much sodium. Be sure to maintain your blood pressure within a normal, healthy range. High blood pressure can cause narrowing and blocking of your blood vessels. High blood pressure can cause your heart to work harder. Those smaller blood vessels make it harder for blood to go throughout your body. Over time, all that hard work leads to an enlarged heart. To meet the increased demands, the heart thickens and becomes larger. It's still able to pump your blood, but it becomes less efficient. The larger the heart becomes, the harder it works to meet your body's needs for oxygen and nutrients. Here are some signs and symptoms of congestive heart failure, including shortness of breath, persistent coughing, buildup of excess fluid in the body tissues, confusion, and an increased heart rate. And you can see here what people with heart failure may experience and why it happens, such as your blood backing up into the pulmonary veins because the heart can't keep up with the supply, which causes fluid to leak into the lungs. Your fluid builds up in your lungs, and as blood flow out of the heart slows, blood returning to the heart through the veins backs up, causing fluid to build up into your tissues. Changing levels of certain substances in the blood, such as sodium, can cause confusion. And to make up for the loss in pumping capacity, the heart beats faster. You can see here on the left what a normal heart looks like and the size of the heart and how it pumps blood out of the left ventricle. And then on the right, you can see this is the heart of a patient with heart failure and how that left ventricle is much larger. The weakened heart muscle can't pump enough blood. Here are some additional resources and literature on congestive heart failure. Here you can see the resources that I utilized for this event. And if you could take a moment now to pause and take the post test.